Welcome to Pet Health in Detail. This channel is all about diving into more detail about your pet's care. I'll go over different disease processes, treatments, and tips so you can make educated decisions about your pet's health. Don't forget to subscribe to get notified when new videos are released. Hi guys, thanks for joining me. Today we're going to talk about common veterinary medication facts. So to start out, disclaimer, this video is to give you an idea of what certain medications are used for, best practices when giving your pet medications, and some common side effects. If you have any further questions, always consult your veterinarian. All right, so 3 simple steps about giving medications to your pets. You want to make sure that you read the actual label on the bottle. Don't go off of memory of what you thought everybody said. You want to make sure to read that label. And then finish all prescribed medications. And if vomiting or other side effects occur, discontinue that medication and call your veterinarian right away. All right, let's start by talking about over-the-counter medication. So although there's lots of veterinary medications originated in the human field, there's a lot of human meds that are actually toxic to our pets. For example, Tylenol, anti-inflammatories like ibuprofen and Advil, and even aspirin. Those are some of the most commonly mistaken as safe for our pets. They can actually be kind of dangerous. They can cause stomach ulcers, blood disorders, and more. It also limits the type of drugs your veterinarian can now use to treat the problem that you were trying to treat. So don't give any over-the-counter medications without talking to your veterinarian first. All right, let's talk about prednisone and other steroids. So prednisone and steroids in general are used to reduce swelling and inflammation. So commonly used in growths, skin inflammation, can also be used for itchiness, and some immune-mediated diseases. So when the immune system starts to attack itself. The main side effects, short term, you'll definitely see increased water intake and urination. And then you'll also see increased appetite. So watch out for those trash cans. Even dogs that don't normally try to get in the trash can, watch out. Long-term use of prednisone typically isn't recommended unless the pet is terminal and it is providing that animal with some quality of life. Long-term use can actually cause diabetes and liver kidney issues as well. This medication is typically administered with a tapering dose. And what that means is the doctor will prescribe on the label, be a really long one. The doctor will prescribe for you to give it twice a day, and then go down to once a day, and then even go down to every other day. So it's important to use a calendar for this medication if you're administering it, especially if you're sharing medicating responsibilities with someone else. You want to know when they gave and when we're supposed to go down and all of that. And then it's real important with this medication to not stop it abruptly. It can cause some metabolism issues, so I want to make sure not to do that. All right, on to antibiotics. So everybody knows antibiotics are there to kill infection, right? So take all prescribed medication. The reason we want to make sure to take all of our antibiotics is because if we stop midway, we actually may be causing our bugs to become resistant to that antibiotic. Most veterinarians will not refill antibiotics without an exam. They need to make sure that everything is looking okay. They may need a stronger antibiotic, who knows. So side effects to antibiotics. Each antibiotic is different, but most common side effect is vomiting. So to reduce the possibility of vomiting, we recommend giving it with food. And what that means is like right after a meal is the best time. So after they eat, give them their antibiotic, and that way the antibiotic's sitting on a bunch of food and can digest easily in their stomach. And if vomiting does occur, make sure you call your veterinarian right away. All right, on to NSAIDs. So NSAIDs stands for non-steroidal anti-inflammatory drug. This is a pain medication. It's basically, we typically use it for after surgery, for arthritis patients, and for muscle pain. There's a lot of options there's a lot of different type of NSAIDs out there, and your veterinarian will choose the best one for your pet based on its overall health, how much it weighs, and also the concern at hand. NSAIDs all need to be given with food. So again, after a meal is the best time. Side effects for short-term use include vomiting and diarrhea. Not very common though. Make sure to give it with that food. You can kind of reduce some of that. Long-term use, it can be great for long-term use, but there are some side effects that we need to be worried about. So actually liver and kidney disease issues can be a side effect of this medication when used long-term. So it's super important to make sure to follow your doctor's recommendation with either semi-annual or annual blood work that they're recommending. What they're doing is looking to make sure that the drug isn't doing more damage than good, basically. And this drug cannot be given with steroids. So make sure, hence the name, non-steroidal, anti-inflammatory, but make sure your doctor knows what medication they're on when you're getting new meds for sure. All right, on to thyroid disease. So we'll talk about dogs first. Dogs actually get what's called hypothyroidism. Basically, it's their metabolism slows down, and they'll oftentimes gain weight. They'll have even though they're not eating very much, they'll have a real low appetite. Sometimes you'll see lethargy, which just means like low energy, and sometimes even some hair loss. Typically, this can be controlled with twice-a-day medicating of a thyroid medication. And what that med's doing is actually helping equalize their metabolism. It can actually make them eat better, feel better, and even maybe lose some weight. So thyroidism does tend to be a lifelong disease. It's not something that's going to go away. So we'll need to be medicating all the rest of their life. The veterinarian will also need to monitor their blood values. So typically we'll do a few times at first to make sure we get them on the right dose. And then after that, just basically yearly, typically. And then for cats get the opposite. They get hyperthyroidism. And so that basically means just a higher than normal metabolism. So common side effects, you're going to see major weight loss. You're going to see a voracious appetite, even though they're losing weight, they're still eating a ton. You'll see high energy, and sometimes the cats will vocalize, just be more vocal in general. So if untreated, your cat will end up with high blood pressure. This can lead to kidney disease, ocular problems, as well as a slew of other issues. So it's important that we treat these kitties. This disease can be treated with medication, which needs blood monitoring. There are also available I-131 treatment. It's basically a radioactive treatment that kind of kills off some of the thyroid itself, and then your pet doesn't, it kind of more normalizes. So there's some risks involved with that, but definitely an option for some people. Definitely talk to your veterinarian about it. So thanks so much for joining me, and I will see you guys on the next video. And there will be a link below on how to administer medications for your pets. So have a great day.